Once the needle is advanced into the bone, we simply pull out the center of the needle, also known as the stylet, and then we attach a syringe to that and simply withdraw the bone marrow from the bone. How is bone marrow concentrate harvested? It is actually a very simple and easy process that we have done thousands of times in our clinic. It is simply done with needles. There are no scalpels or knives that are necessary. Basically, what's done is somebody is lying on their stomach with their lower back exposed. And first, we will use a small needle just to numb the skin. And then through that needle, we'll use a slightly longer needle to go down and numb the bone. The patient may feel a little bit of burning when we're numbing the bone, but that is it. Once that bone is numb, you do not feel the needle going into the bone. It is very easy to advance the needle into the bone, either by using a trocar or even a small drill to get into the bone. And again, it is a very painless process. For people that have some apprehension about that process, we have different ways of making it more comfortable for you, including having laughing gas in the office, or for some patients that they want to take a medication to relax them, we can offer that. But most of our patients just do this under local anesthesia. Once the needle is advanced into the bone, we simply pull out the center of the needle, also known as the stylet, and then we attach a syringe to that and simply withdraw the bone marrow from the bone. Once we take that bone marrow from you, we take it to our laboratory, which is right in our office, and we need then to process that bone marrow so we can isolate the cells that we want to use, the growth factors and the stem cells. Bone marrow is about 95% other cells, cells that we don't want to use, red blood cells, white blood cells, plasma. We only want the stem cells and the growth factors. So we only want about 5% of what we extract from you. It takes my laboratory about an hour and a half to 2 hours to do that through our high-speed centrifuge and Regenexx processing techniques. And once we have the isolated stem cells and growth factors, then we bring you back and have them ready to go into the joint that we are going to be treating. So we do have laughing gas in the office, which is very commonly used by dental practices. What it does is just relaxes the patient so you really don't feel anything. Again, it makes the process just more comfortable for somebody undergoing this. However, it's an option and it's certainly not necessary. I would say about half of our patients utilize it and about half don't, but it is a nice option just to make it so you feel as comfortable as possible during the entire procedure. Once you're able to isolate your bone marrow and take it to our laboratory, because we are Regenexx Pittsburgh, we have the Regenexx proprietary centrifuge system, which is the best technology in the business. Do you have bone-on-bone knee arthritis? Do you have severe pain in your shoulder, hip, knee, elbow, wrist, or other joint in your body? Have you been told that surgery is your only solution? Come see us at Regenexx Pittsburgh, as we have great treatment options for you. Your office visit will be covered by your health insurance, and we will give you an honest opinion as to whether or not our treatments are something that may be beneficial for you.